so hopefully some more people will join as we proceed. But this is the first of a number of healthcare webinars we're planning to hold, although certainly not the first webinar since the onset of COVID-19, and we've had a series of these focusing on various issues that have arisen in relation to the pandemic. Our next webinar of this kind will be focusing in particular on digital health. If you've got any questions, I suggest, so we don't talk over each other, you store them up to the end. If you want to raise questions as we go along while you think of them in relation to any of the content, then do please enter your question in the conversation pane, but otherwise we'll ask everyone to kind of unmute their mics at the end if they want to ask any questions. This webinar is being recorded in case people want to review it subsequently, so do let us know if you have any concerns on that, and we'll send you the slides after the talk to the extent that that's helpful. So our agenda today, we will start by focusing on issues around supporting vulnerable individuals in line with COVID-19 restrictions, and Katie will talk about that by way of a general introduction, but can get into many of the more sort of detailed issues if that's of interest, or pick those up subsequently offline. Ben Tarrant will then talk about landlord and tenant relationships in relation to healthcare property, and in particular how to deal with construction projects and property works. Katie Farmer from our restructuring and insolvency team will talk about the cash flow implications of COVID-19, and then I'll finish up by focusing on directors' duties and just some themes we're seeing in relation to decisions that boards are having to face, particularly around investment. So with that, I'll pass over to Katie Webber to start by talking about supporting vulnerable individuals. Katie.
Thank you very much, Jocelyn. So as Jocelyn explained, my name's Katie Webber. My primary area of expertise is advising health and social care providers and individuals in relation to mental capacity law and policy. The vast majority of organisations and individuals that I work alongside either operate or utilise care homes. And as we're all highly aware, the impact of COVID-19 on care homes in particular is coming increasingly under the scrutiny of politicians and the media as the pandemic rolls on. We'll all have seen news reports regarding concerns over deaths within care homes and lack of PPE in that setting. But today I'm going to talk through some of the wider operational challenges and considerations that independent care homes have had to become alive to in order to protect their vulnerable residents and uphold their rights. Hopefully this will help put into context some of the wider organisational and financial concerns that my colleagues are going to address later in the session. Many business owners in the social care sector feel that their concerns were ignored in the early stage of the pandemic. This is particularly concerning as a recent FT article reported that there are over 11,000 such businesses in the UK and around 430,000 care home residents. Care homes themselves appeared to react relatively early, with many shutting their doors to visitors from early March. However, this step brought with it its own challenges, firstly in relation to care home admissions arrangements. This is where I'll move on to the next slide. Jocelyn, I apologise, I don't appear to have the opportunity to step on, so if you could do that for me, I'd be very grateful. Thank you. So as I say, care homes themselves appeared to react relatively early, shutting their doors to visitors, but with that started to come considerations regarding shutting their doors to new residents. Mainly because they were concerned about the risk of infection by accepting new residents, particularly those coming from hospital settings. This in turn had an appreciable impact on profit margins and bed availability. Most care homes work to very tight margins that require their businesses to be operating close to or at full capacity. And while the decision to prioritise residents over the safety of existing residents over profit margins was highly understandable, it resulted in significant difficulties in the first couple of weeks of the pandemic in managing new care home placement. The system ordinarily relies on movement and fluctuations in bed availability to ensure that those who tip over into needing residential care of some form, or those being discharged from hospitals back into residential care settings, can have their needs met. The concern around the lack of fluidity with bed availability became such that in early April, the Department of Health and Social Care, Public Health England, the CQC and NHS published guidance for care home admissions and readmissions during the COVID-19 outbreak. The guidance sets out that the care sector is expected to play a vital role in accepting patients from hospitals and other settings during the pandemic, and the aim was to ensure that the full capacity within the sector is being utilised in order that hospital beds are freed up for those who need acute care. In accordance with the guidance, all care homes are now required to put data into a capacity tracker and keep it updated as close to real time as is practicable. The tracker monitors care home vacancies and bed capacity and supports a system-wide bed and discharge planning process. The admissions guidance, primarily put together by the Department of Health and Social Care, also goes on to set out that if an individual coming into a care home setting has no COVID-19 symptoms or has tested positive for COVID-19 but is no longer showing symptoms and has completed their 14-day isolation period, then their care can be provided within the care home setting as normal. Equally, care homes might receive residents who have previously tested positive and are no longer showing symptoms but have not yet completed their isolation period. The guidance states that care homes have to support residents to isolate in their rooms and to minimise the number of staff providing care to them to prevent the possible spread throughout the rest of the resident population. For those coming from hospital, the hospital discharge and service will clarify with care homes the COVID-19 status of an individual and any symptoms during the process of transfer from hospital to the care home. Now, concerningly, as many of us are probably aware, testing wasn't available to all individuals being discharged from hospital to care homes until the last couple of weeks. Care homes were therefore required to manage the possible risks for themselves and isolate residents in their room for 14 days. Now that testing is more widespread and residents entering care home settings should have access to testing, care homes are still asked by the Department of Health and Social Care to avoid blanket refusals on the acceptance of COVID positive patients where the risks can be managed. However, this is a huge logistical difficulty in the vast majority of care homes, where it's often impossible to control the movement of residents and staff to particular parts of the home. My personal experience is certainly that the majority of care homes will now understandably only agree to accept a new resident if they've received testing and have had a negative result, regardless of the contents of the Department of Health guidance. Understandably, care homes are keen to place their existing residents first and avoid the considerable fallout of an outbreak within their properties. Moving on now to my next slide, and managing the movement and distancing within care home environments. Further guidance in this regard has been produced by the British Geriatric Society and aims to provide a checklist of considerations for residential care providers during the course of the pandemic. In relation to movement of residents within the care home, the guidance asks that all care homes consider whether it's feasible for residents to be cared for within their individual rooms and to avoid accessing communal areas. Again, in speaking to managers and trying to understand the situation on the ground, I'm aware that many have established this to be entirely impractical. First, it has a significant impact on the general and social well-being of residents at a time when they're already unable to have any face-to-face contact with their loved ones. And secondly, because of the very high proportion of residents with cognitive difficulties who wouldn't be able to understand or follow instructions to remain in their rooms. Care homes have been encouraged to introduce policies to address zoning and manage wandering residents in this context. And of course, this all adds to the already extremely significant administrative and practical burden on care home businesses. In addition to the administrative burdens, restrictions on movement or zoning of care homes is particularly pertinent and difficult for those within those settings who lack mental capacity. As I mentioned earlier, my expertise is in advising on mental capacity policy, and this is something that I've been called on to advise on in relation to a number of care home settings during the course of the pandemic. While those who are cognitively able are in a position to consent to some of the additional restrictions that are being placed on them by virtue of the fact that they're in a care home setting, those lacking capacity to consent are likely to fall within the operation of something that we call the deprivation of liberty safeguards. Those safeguards are in place to ensure that those lacking mental capacity are not deprived of their liberty without the proper checks and balances in place. And the safeguards will apply to anyone who is not free to leave the care home setting, is subject to continuous supervision and control there, and who lacks mental capacity to consent to the restrictions imposed on them. Any restrictions on movements in or outside care homes will either increase the restrictions on a person who's already subject to the safeguards, and in some circumstances may mean that the safeguards apply to residents for the first time. The safeguards include regular assessment and review of whether restrictive measures are in a person's best interest and have to be conducted on a person-specific basis. So all of these new restrictions and steps that are having to be taken to organise care homes and minimise the risk of infection add an extra layer of administrative burden on care homes who have to review the deprivation of liberty position for each of their residents. The final topic that I want to cover that has become a particularly pertinent consideration for those operating care homes during the course of the pandemic is advanced care planning. All care homes are in general encouraged to engage in advanced care planning with individual residents, families and clinicians, but it's extremely important at the present time. Where a person has capacity to make decisions about their advanced care plan, the plan should always be discussed with them directly. But where someone lacks capacity to engage in that process, then it's reasonable for a plan to be produced in consultation with everyone involved and agreed in the event, and agreed if it is within that person's best interest. Advanced care plans may include reference to do not resuscitate notices or respect forms, which set out how a person would wish to be cared for at the end of their life. In the early stages of the pandemic, there was considerable confusion, and many care homes reported receiving calls from local GP surgeries to advise that do not resuscitate notices would be applied to all of their residents. This was clearly unlawful, and it's highly inappropriate for these types of decisions to be made on a blanket basis. Care homes should instead be engaging with clinicians and family members to produce person-centred plans that take into account the individual's own prognosis and wishes. Such was the concern that again in early April, the British Medical Association, in conjunction with the CQC and others, produced the guidance shown on the current slide. Happily now this appears to have mitigated against the use of blanket advanced care planning, but does mean that care providers are compelled to review the measures in place for each of their residents so that they can avoid future confusion and that resident care pathways are clear to all concerned. Now, I apologise that my part of this discussion has been relatively doom and gloom, but I think it's important to understand and appreciate the additional measures that care homes are having to take at the present time, many of which are sort of beyond the matters that we see reported in the media headlines. It's an extremely difficult time for them on all fronts, but to end on a positive note, those that I'm working with or alongside appear to be adapting extremely well, rising to the new regulatory challenges, and are most importantly putting the safety of their residents at the heart of all they do. So thank you very much for listening. There will certainly be the opportunity for me to address any questions at the end of this session, but for now I'll pass on to my colleague Ben Tarrant.
Many thanks, Katie. Good afternoon, everyone. My name is Ben Tarrant. I'm a lawyer in the real estate team at Ashford with a particular focus on healthcare properties. So that includes acquisitions, disposal, and financing. So today, I'm going to highlight a few property issues that we're seeing at the moment affecting landlords, tenants, and management of healthcare properties generally. It's fair to say that healthcare properties have some very particular characteristics which makes them different to other types of properties in the market, in that they are normally fitted out with specialist equipment. They're not really suitable for alternative use without extensive works. They cannot really function without the public visiting them. They are very location specific and almost always rely on funding, be that private funding or public funding or insurance. And of course, almost every healthcare property operates in a highly regulated environment. And I think it's fair to say all these factors have placed great strain on property ownership, occupation and management over the last few weeks. And right now, I'm not sure that we see a clear way forward. The two areas I wanted to highlight today are firstly the impact of COVID-19 on the landlord and tenant relationship, and secondly the impact on construction projects and other works that may be being carried out by landlords and or tenants of healthcare properties. So looking firstly at the landlord and tenant relationship, the sort of issue at the top of the list really since March has been payment of rent. In lots of cases, demand is massively reduced and in some cases has completely gone. Costs are still high and certainly in some healthcare businesses, they've had to invest more money in buying equipment, in training staff, etc. And all of that has caused massive cash flow problems. In particular, those who rely on appointments and paying customers. So against a background where income is massively reduced and rent is therefore a sort of key expense, it's not a surprise to hear that it's come under considerable scrutiny. All of the help so far has been focused on tenants or occupiers to protect them against the so-called aggressive debt recovery actions of landlords. Some key points to note since March really are the introduction of a moratorium on forfeiture of commercial leases for non-payment of rent, and that is due to last until at least end of June. I suspect it will be extended. Secondly, landlords are now prevented from using the commercial rent arrears recovery process. That is where normally a landlord can take possession of a tenant's goods and basically sell them. That can't apply unless 90 days or more of rent is unpaid. And this will be introduced very, very soon, but there is an imminent new piece of statute which will mean that statutory demands and winding up petitions issued against commercial tenants where that tenant can't pay the rent for COVID-19 reasons are going to be temporarily voided. So all of that offers protection to a tenant, but what options are open to landlords who might be facing lots of tenants turning around and saying, "I'm sorry, I can't pay"? Well, my landlords can still issue a debt claim. They can still draw down on rent deposits. They can still look at guarantees or even former tenants under ARGAs. But as things stand, landlords have nowhere near the same level of protection as tenants. So there's nothing preventing banks or investors or financial institutions from exercising rights under their agreements with landlords if they default, and that is due to their tenants not paying the rent. What should tenants do? But the advice we're giving is don't stay silent, don't ignore it, engage as soon as you can with your landlord. It's important to remember that the measures that I've set out above don't excuse non-payment of rent. You've still got an obligation to pay. And of course, both parties have to maintain a relationship when we get through this. So it's important that the parties get talking and reach a reasonable sort of outcome for both parties. We've dealt with a lot of side agreements over the last couple of months. Some tenants have gone on to monthly rents. Some where their income has completely stopped have basically agreed rent-free periods, because it's better ultimately for the tenant to have responsibility for the property. And after all, what is the landlord going to do with a fully fitted out care centre? Its options are quite limited. We've also seen deferred rent payments, so where the rent will be paid but not now. It's important to just bear in mind in terms of timings, these arrangements often need bank and or board approval. So sometimes it can't happen as quickly as perhaps we would like. Some landlords are just saying, look, I'm not going to agree anything, you pay what you can and let's just keep it under review. And of course, actually that's probably quite sensible, because I do feel that those landlords and tenants who entered into agreements in March on the basis that they only apply until the June quarter might get to the June quarter and think, that wasn't quite right, was it? So just moving on then to break clauses. So as my listeners might know, break clauses in leases contain conditions that have to be satisfied in order for the break to be effective and the lease ended. And these conditions include vacant possession, carrying out works, taking out alterations, etc. I'm afraid to say, as things stand, the current lockdown situation cannot be relied upon as an argument for not complying with those conditions, and landlords are entitled to insist that those conditions are met, otherwise the lease is likely to continue. That is not a great situation, but the government has not introduced any guidance on points like this as yet. Secondly, if you come to the end of a lease, again, you've got obligations to hand it back in good repair, to take out alterations, to give vacant possession. Of course, tenants might struggle to get the works done where premises are closed, there's no staff in them, or contractors can't get hold of materials, or indeed might struggle to comply with the distancing guidelines. Next, I wanted just to mention rent reviews quickly. If you have a 10 or a 20-year lease that was granted in 2015, then you may well have a rent review this year, which is quite an interesting issue. Luckily, most rent review clauses state that time is not of the essence. So if it gets put back until later, that's okay. The interesting point, though, is what about the rent value? If the rent review was due to take place in February, for example, so pre-outbreak in this country or pre-lockdown, then the impact of lockdown on the market is disregarded. If the rent review takes place now, then if you've got an upwards and downwards a rent review, then I think we can expect to see a fall in the rent levels. So there's different arguments for having the rent review now and having it a bit later. The issue, of course, is if you need a surveyor to go and give you a rental valuation, are they going to be able to get into the property? Question mark. That is also relevant to the lease renewal process under the Landlord and Tenant Act 1954. Again, of course, people can still serve the Section 25 and Section 26 notices, but what about the next steps? What if the parties can't agree the rent? And the sort of interesting point here is that the assessment of rent under the 54 Act does not have to be upward only. So again, you're going to have the same problem that tenants would want to press on, and landlords want to basically hold it up in the hope that the rent levels increase in the near future. Finally, in this section, just wanted to mention a point around conditions in buildings insurance policies. So if a property was unoccupied prior to the COVID outbreak, then it's important to bear in mind that the conditions around unoccupied property still apply, and that might be difficult, but the policy stands and the conditions stand. For premises that have become unoccupied during the COVID outbreak, then a number of insurers have relaxed their requirements, but it's important you check that, because if there is an incident and you've got to make a claim and you haven't complied with some of the conditions and the insurer hasn't waived them, you could find that you don't have cover. So moving on then to part 2 and construction projects and other works that are carried out at properties at the moment. This is a key concern because lots of people have got ongoing construction projects and fit outs and all sorts of other types of work. So tenants might find themselves in difficulty here for a couple of reasons. They might have completed a lease, say, in February, and might have a certain period to complete those works and might have been given a rent-free period of 3 or 6 months or to complete those works. And of course, if the contractor is down tools and if there's nobody on site, then time is ticking, and you could find that the rent-free period disappears, and then you've got to start paying rent, but you can't use the property because it's not fitted out and hasn't got any equipment in it. Secondly, if you are going to move premises and the contractor hasn't finished or can't finish for a while, in time for you to relocate prior to expiry of the current lease of premises elsewhere, what are you going to do? You can demand that the contractor comes back onto site, but you also might need to look at asking your current landlord to extend your occupation, which is a risk, but it's definitely worth having that conversation early on. Next up, landlords might also have obligations to construct a property or carry out refurb works or fit out works by a long stop date, and that will have a target date a few months before. It's fair to say that most agreements for lease that are conditional upon works contain the ability for a landlord to extend the target date in line with extensions allowed under the building contract, but the long stop date normally is exactly that. It's the drop dead date. You know, if you haven't done the work by then, most agreements will say either party can terminate. So it's important for landlords who have agreed to do works to carefully consider those agreements and start talking to people about timings. A tenant, on the other hand, who has signed a agreement for lease in, say, December, might be looking at this now thinking, right, okay, I thought I was going to grow. I thought I had all these new patients. I thought I had this new business stream in that location. Now what am I going to do? So we are starting to see quite a few arrangements where either people are sort of extending time to complete, or there are additional rent-free periods to cover a scenario just to give the tenant longer to get going. Of course, it's difficult to predict now how long all this is going to take. So I can see things being agreed that then have to be revisited in the future. So finally, just to finish up on this point, just some provisions in standard form construction contracts to be aware of. I accept that these are quite often amended, but just to give you an outline on some sort of general themes that we're seeing, just be aware of the so-called no-fault termination right in lots of JCT contracts. So this applies if the works are suspended for 2 months as a consequence of either a force majeure or the UK government effectively exercising its statutory powers, and that affects the execution of the works. There, either party may essentially terminate the contract unless works restart within 7 days. Secondly, contractors have generally got a right to extend time in the event that the government exercises its powers and that affects the works. But this is the real one. At the moment, there's no government guidance and there's no legislation to support the view that COVID-19 is essentially a relevant event. So I think contractors are going to struggle to justify extensions of time for that reason. Similarly, the concept of force majeure, this basically gives people a get out if something occurs that's not within anyone's power or control. Now, our problem here is there's no definition in English law as to what that means. There's no definition in the JCT contract. And again, there's no authority. There haven't been any cases. There's no guidance from government as to whether COVID-19 is an event of force majeure that would in turn give rise to an extension of time. So you can imagine we're going to see all sorts of fun and games on that shortly. It's important to also note that contractors are responsible for the additional costs under the standard form contract of completing these works once restrictions are lifted. So that's something just to be aware of as well. And this is an important point too here, that the employer, so the party who's responsible for carrying out the work, still has to comply with its obligations under the contract too. And any failure might give claim to both an extension of time or a claim for losses and expenses on the basis of impediment, prevention or default. So if you as an employer don't give instructions or don't give information or don't give access, then you could find that you're in breach. Anyway, that's it from me. I hope that's been a useful summary. I appreciate it's been a quick canter, but there's quite a lot to cover of some of the issues to think about in terms of landlord and tenant relationships, but also in terms of ongoing works and construction contracts. I'm going to hand over now to Katie Farmer, who's going to talk to you about addressing the cash flow implications of COVID-19. Thanks for listening. I'm very happy to discuss any points at the end or indeed offline if that's more appropriate. Thank you.
Thanks, Ben. As Ben said, widespread among many sectors is a squeeze on cash flow caused by business interruption. While some in the health and social care sector will find themselves quite buoyant at the moment, others will have seen an immediate cessation in income. We know, for example, the dental market is particularly affected after the chief dental officer called for an immediate cessation of all routine work, and it's not clear when that may change. And the British Dental Association has suggested that up to 1 in 5 dental practices are at risk of closure as a result of the financial impact of no work being undertaken. And so businesses without cash reserves will see a knock-on impact on their ability to settle their debts, where, for example, next month's income is generally used to settle invoices that may arrive in this month. As well as needing a steady cash flow for day-to-day operations, cash flow is important as an indicator of the long-term viability of a business. This is because the statutory definition of insolvency includes the inability to pay debts as they fall due, otherwise known as the cash flow test. Businesses that run out of cash risk formal insolvency. As a result, we are now seeing many businesses taking fairly robust collection action as suppliers and other creditors are looking to protect their own cash flow to survive this period. So many businesses feeling the pinch or facing an overnight drop to nil income, collecting in debts has become very important. There's lots of advice and tips out there for businesses in that position, but the usual things apply, and particularly what Ben was saying in the context of sort of collaboration and talking to the people, your counterparties, the people in contractual relationships where there are issues that are cropping up. On the debtor side, the businesses affected by reduced income will need to make sure that they are considering and accessing all of the business support that's out there. That might include, for example, the job retention scheme, the ability to defer VAT payments, the business loan interruption schemes, etc. And also considering whether specific regulators or trade bodies might have guidance, advice and support which can be accessed. However, most of those measures do need to be considered in the long term as well as the shorter term. For example, any deferred arrangements will need to be paid in the future. So Ben mentioned the possibility of negotiating a deferral of the rent that's due now, and I mentioned the VAT deferral scheme that the government announced. But of course, that's simply delaying an obligation to pay, and so that can put strain on future cash flow too. Clearly the concerns about cash flow are going to be something that's uppermost in mind for many businesses at this time. And so what I've shown on the slide here is a visual about the stages towards of decline, which has been helpfully produced by the Institute of Chartered Accountants. But it really helps to take a step back, and for businesses that are impacted to try and consider objectively, how operations have been affected and the impact on their financial viability, and to think about where they might be in the curve. There are options for business experiencing difficulties or recognising that they're somewhere possibly on that downward trajectory. In order to think about those options, it's always really important that businesses have got access to objective information for their decision making. So this is likely to include, up-to-date information on current liabilities, a good handle on what the future debts might be, including any deferred liabilities, cash flow projections, which I know a number of accountant contacts are assisting their clients with. Obviously it's very difficult to be definitive about when the cash may start to flow again for businesses that have seen some interruption to their operations, but that sort of information can make a big difference in terms of addressing a downward move on that curve. Typically, the earlier intervention is sought, the more rescue options tend to be available. So typically, we say that the warning signs for recognising that downward trajectory include things like sales decline and less tangible cash available, but also things like recent refinancing, creditor days growing, payment excuses, employee turnover and hiring freeze, overdue accounts or returns at a company's house, other creditors starting to take action, bailiff HMRC visits, and collapse of a key customer or some key counterparty in a supply chain that can have that sort of ripple effect. And so, it's clear that many businesses at the moment might be seeing one or other of those things going on as a result of COVID-19, and that doesn't necessarily mean that there isn't a good business that has long-term prospects, but clearly that this is a short-term issue that's having a tremendous impact. There are options to deal with this, so as well as the specific coronavirus measures that the government's introduced, in a normal situation there would also be things to consider, such as, say, redundancy, some restructuring or refinancing, negotiation with creditors and so forth. And one of the new measures that the government has announced is a pre-insolvency interim moratorium, which will give a bit of breathing space to sort of work out which direction to go in, but free from the pressure of creditor action. Short-term concerns about insolvency do not necessarily mean that a business needs to go into an insolvency process. So there is no particular obligation to ensure that a business does not trade while insolvent. But when insolvency is in doubt, or there is insufficient cash to get through a short-term or hopefully short-term position, then there may be a need for formal insolvency regimes, which I've set out on the slide. Now, in this jurisdiction, we have a number of different insolvency regimes, and they're on a sliding scale from rescue to terminal process. Each has different features and objectives and outcomes. recognising that concerns about solvency will be key for directors of many companies, and there are some businesses that, particularly in the healthcare sector, that will not be able to simply shut up shop. So care homes, for example, can't simply close their doors while they've got residents there. There have been some relaxation on the rules on consequences for directors as in response to coronavirus. So one of those is, for example, the relaxation of rules in relation to wrongful trading. The idea being that it gives business owners, directors, extra time to weather the particular storm. Directors will, of course, need, though, to be mindful of their duties and take advice if they think that solvency is an issue. And Jocelyn's going to speak about this in a moment. That it may well be that it is necessary to take advice and consider one of these types of solution tailor-made to the particular business. I think it's fair to say at this stage there's been no immediate wave of insolvency. There have been some high-profile retail and hospitality administrations, but the government's response in terms of financial measures have perhaps flattened the curve in terms of insolvency, but certainly turnaround and restructuring professionals are braced for their own peak in the later parts of the year, particularly as we may see measures that have been available start to be withdrawn, and how that works with a lot of unknown variables, such as when sort of normal business may be able to resume. Certainly I'm aware that restructuring professionals are starting to see inquiries from affected healthcare businesses, and dental practices are a key one there, with income having sort of dried up overnight. Options are clearly complex in the current circumstances. So while we're in anything but a business as normal situation, for most businesses the importance of cash flowing in is still going to be as essential as ever. So I hope that's a useful view of cash flow in the current circumstances, and like my colleagues, I'm very happy to take questions at the end.
Katie, thanks very much for that. As I mentioned on the call, for the benefit of those people who joined a bit late, we can take a few questions at the end, although I'm conscious we're only scheduled to run for another 10 minutes. If you do want to ask any questions in the meantime, do use the conversation pane down the side. This webinar is also being recorded, so if you prefer to ask the questions in writing, please do, and obviously do follow up with any of us after the call using our contact details on the slides that we'll also send you if there's anything more specific you want to raise with us. But I'm just going to conclude now by focusing a little bit on directors' duties and how they play into some of the thinking processes that we've outlined earlier on this call, and in relation to investment decisions generally, an area where many of you will have first-hand experience. And first of all, just going back to first principles in terms of directors' duties, obviously the key obligation here under the Companies Act, as you'll be familiar with, is the obligation for directors to act in a way they consider in good faith would be most likely to promote the success of the company for the benefit of its members as a whole. There are obviously some companies that are set up with specific purposes where the duty to promote the success for the benefit of its members is replaced by duty to promote the success of the company with a view to those purposes, but that will be the test for most companies. And very often you'll see reference in board minutes, if indeed it's a while since you last had a quick update on directors' duties, flagging that the board has had due regard to the other matters that are specified in section 172 as things that boards should have regard to, including the likely consequences of any decision in the long term, the interests of companies' employees, and the need to foster business relationships with suppliers, customers and others. And there are also a few requirements around business integrity, taking into account community impact and the need to act fairly between different shareholders of a company as well. And embedded within this piece of statute, but often overlooked, is that these obligations are subject to the requirements in certain circumstances to act in the best interests of creditors. And I've quoted a bit of case law here as to the circumstances when the duties of creditors towards creditors will start to be paramount, in particular where a company is insolvent or on the verge of insolvency. And that's the point at which we would start to play in, Katie Farmer or one of her colleagues in our restructuring insolvency team, to talk to boards and in appropriate circumstances also to line up a insolvency practitioner to talk the board through their duties and how they can take all possible steps to protect creditors. Taking a step back in terms of the discharge of those duties in practice, just as considerations for people who are sitting on boards or managing businesses, one of the most important issues we often talk to boards about from a corporate governance perspective is around the question of information risk, which is whether directors, management are receiving the information they need, they're receiving it in a way that is useful and they can access, and they can filter out what they don't need. And at this point where physical contact is no longer possible, using the post or couriers can be doubtful. Those boards who, for instance, are used to producing short, concise board packs delivered on tablets or through other online means, are generally a little bit ahead of the game in terms of making sure that a lot of information, useful information, can be passed up to directors. At a crisis like this, there's also a question as to whether boards are meeting often enough, both to address key decisions addressing the business, but also to provide appropriate supports to executive teams. And I talked about the duties in section 172 and the need to have regard to long-term consequences, and balancing priorities, immediate priorities and long-term consequences at this point has possibly never been harder. You may have seen the news in the FT on Monday of HC1 reporting in its financial statements that the directors were very concerned about material uncertainties regarding COVID-19 that might, if you look at downside scenarios, cast a significant doubt on the group's ability to continue as a going concern. And one of the points that was particularly flagged in the article as a concern there was not just the impact of loan repayments, but also the increasing costs associated with PPE and other essential equipment. And that then draws in one of the other requirements, which is the need to consider the interests of employees. And at this juncture in the fight against COVID-19, it would be a brave person who's trying to balance out the cost to a business of PPE and the well-being of their staff against the long-term financial consequences for businesses. But that is indeed where large parts of the sector currently at and engaging, and indeed Jane Townsend, the CEO of the UK Home Care Association, has been particularly tireless in flagging that as a concern and getting governments to relax the VAT regime in relation to PPE equipment. In terms of broader challenges for the sector, where does this leave boards? Where does this leave companies? Well, as Katie was talking about, focusing in a razor-sharp way on cash flow projections, particularly over a 13-week period. Looking also, I think, at regular communications, both with payors and service users, and picking up one of the points that Ben was raising earlier in connection with force majeure provisions in construction contracts. In a lot of commercial contracts in the health and social care space, we've seen instances where companies have been seeking to invoke force majeure, but perhaps more importantly, talking to their service users and payors as to the practical constraints they're having in helping their service users at this time, and seeking to gain a sort of shared understanding of the point at which normal service can resume. So looking to the long term, companies also need to be focusing not just on how to ride out this peak of the pandemic, but also to anticipate further potential peaks which may come at more difficult times of the year, like next winter, and how to plan ahead and not just keep going for the next 2 quarters. Indeed, the view amongst insolvency practitioners at the moment, the received wisdom seems to be that we'll see a particular spike in insolvencies around the last quarter of this year and the first quarter of next year, as some of the dynamics Katie was talking about earlier starts to play out. One of the points that's been commented on extensively in relation to the impact of coronavirus has been the acceleration of the digital transformation of all businesses, as many of us start to work remotely from home, and indeed within a care setting, the usual practice of sending out teams from head office to go on site visits around care homes in a group has given way to video interaction between sites and management, and we anticipate that even as the pandemic starts to come under more control, and indeed even if we get to a point where a scalable vaccine can be rolled out next year, we may see a continuation of some of those trends as groups decide it's more appropriate for managers not involved in frontline care generally to try and keep away from the homes. Clearly, in the context of M&A and other investment activity of that kind, site visits have always been seen as crucial, along with face-to-face meetings with management, to give people enough comfort to proceed with those transactions. We are seeing a reasonable amount of transactional activity, particularly in the digital health space, and it may be that part of the explanation for that isn't just the ability of digital health companies to survive and indeed kind of flourish in this environment, but also that it's easier to execute these kinds of transactions at the moment. I think the biggest hurdle to executing transactions generally is the uncertainty as to what level of financial value can be attributed to assets in the current environment, either as a seller or as a buyer. I think probably the first step companies took when the pandemic hit in terms of financial management was to stop paying out dividends to shareholders where there were concerns about cash flow, and obviously paying out dividends at this stage where there is any concern about future cash flow is an area in which it would probably be worth taking advice and considering it very carefully. And equally, where a company does start to have concerns about being able to pay all its creditors, companies need to take great care over paying certain creditors in favor of others, particularly if there's a connection between the creditor and the business, to avoid that being set aside later as a preferential payment that could even lead to some exposure for directors. Anyway, I've rattled through that a little bit. I'm conscious we're now slightly over time, but if anyone does have any questions on the call, do unmute your mics and share those with us. Otherwise, we very much look forward to keeping in touch about these developments as time goes on, and hope you'll keep well. Katie, were there any questions that you've had separately you wanted to address?
No, I don't have any. I don't have any separate questions popping up. So.
Great. Well, thank you very much, everyone, and look forward to keeping in touch. I hope that's been useful.
Thank you.
Thank you all.